Fine?
Yes, ma'am. Thank you so much.
Thank you.
Hello, Dr. Poonam. Ma'am, are you there?
Hello.
Hello, ma'am. Can you please switch on your camera and mic for testing?
Okay.
Yes, ma'am.
Am I audible?
Yes, ma'am.
Is the voice clear?
Yes, totally.
Thank you.
Yes, ma'am.
Major General Ashok Kumar, sir. Hello, sir.
Good afternoon.
Hello, good afternoon, sir. Sir, can you please switch on your camera and mic for testing?
1 minute. Okay. Yeah. Can you see me?
Yes, sir, we can.
Good afternoon, and how are you all?
We are fine, sir. How are you?
Good. Happiness.
Good to hear you, sir. Thank you so much. We are going to start shortly.
Okay.
Thank you.
Take my mic off. Oh, chai.
Hello, Dr. Madan. Can you please switch on your camera for testing? Sir, are you there? Dr. Madan?
Yes, Shivani.
Hello, sir.
Just finished I was on another call. I just finished that.
Okay.
Okay. Thanks. Just
Sir,
joining.
can you please switch on your
Yes.
camera?
Yes, joining.
Okay.
Okay. Thanks. It's fine.
Yes, sir. Thank you so much.
Okay.
Good evening, everyone. A warm and a humble welcome to the 29th webinar of the webinar series under Youth and Adolescent. My name is Shivani Bhatia, moderating the webinar with my colleague Aliza Hassan on school safety and COVID protection. Here is a survey on your screen. Please fill it. It is also open for the panelists as well. और अगर आप ये कार्यक्रम हिंदी में सुनना चाहते हैं तो आप हिंदी इंटरप्रेटर ऑन करके ये पूरा प्रोग्राम हिंदी में सुन सकते हैं।
Good evening, everyone. My name is Aliza Hassan.
And my name is Shivani Bhatia. We will be moderating the today's webinar, and I once again extend a very warm welcome to all the panelists, principal, teachers, public health professionals, and especially our health ambassadors.
Let me introduce you all with SHARP. SHARP stands for School Health Annual Report Program. It's a non-governmental pan-India health organization, and we have recently completed 21 years in this field. We work for the healthcare of students and children, which is professionally managed by eminent psychologists, nutritionists, counselors, and people like you and I who have vision to promote healthcare.
The return to school introduces new challenges to maintaining student health and wellness. School nurses, staff, and other health professionals play a very important role in keeping the school and students safe. But globally, the health system has been challenged so much due to COVID-19 pandemic that it is important that we discuss new challenges, new framework of strengthening our health services, especially for school, by building capacities for health professionals, adopting new technologies, and implementing strategies for better health.
COVID-19 has left a big room to discuss over the subject. For the same objective of discussion, we here have with us our esteemed panelist, Dr. Madan Gopal, Major General Ashok Kumar Singh, Dr. Poonam Joshi, and Ms. Anu Bhatia. We again welcome you all. Few instructions before we go further. We will let each panelist speak first, and then we will have a question and answer round. All the questions will be taken live. Please drop questions in the Q&A box with the name of the panelist you want to ask question to. The sharpest question from the audience will be given a gift voucher from Sharp of rupees 1000. Also, I request all the attendees and audience to not flood the chat box with unnecessary messages, as we tend to miss out the important ones.
Thank you so much, Aliza. Without further ado, I would now like to invite our first panelist, Dr. K. Madan Gopal. Dr. Gopal is a health professional with MBBS, MD qualification and has been working on issues related to health system reform and strengthening in India for more than 28 years. Currently, Dr. Madan is working with NITI Aayog, National Institute of Transforming India, the apex policy think tank for Government of India, as a senior consultant. We are so glad to have you, sir. Over to you.
Okay, thank you. Good evening, everybody. Thanks for this opportunity. I will straight away start with my slides because the format which has been shared that there should be a 10 minutes talk from my side. I would be using the presentation. I think I would be sharing the slides. Okay. I think it's visible.
Yes, sir.
Okay. As you have rightly pointed out, the COVID pandemic has thrown a lot of challenges. When it's almost 1 year now. Last year, we remember that we started all these activities with the Janta curfew on 22nd of March. Then we had that lockdown. As a result, first thing which we did was stopping all the things, including schools. Now, we have matured enough. We know how the virus is behaving, how the virus is transmitting, and what kind of age groups it is affecting. That information is there. After having all this information, now we are having some confidence that now we can start reopening the schools with certain standard operating procedures. Side by side, we need to think about strengthening the healthcare services in the school, especially during the COVID times. Before the COVID times, it was only limited to just screening. Once a year, somebody will come, they will do the dental checkup, they will take the height, weight, and other measurements, and that's all. That's a school thing which we are having. Or some of the schools, they will be doing a deworm as well as some vaccination drive. Overall, after that, now during the COVID times, things have changed. We should be having more vigilant. We should be focusing more on the healthcare so that the confidence is there in the students as well as in the teachers that yes, if the confidence is there, the absenteeism would be taken care. Having said this, I will just highlight you that what is the situation of the COVID virus. You would be all listening that the numbers are declining. But you look at the peaks which have happened in the Europe, in the different regions of the country, different regions of the globe, it is coming down. That means it's a very reassuring that the virus is now more or less, the first phase is now over. Now we are declining. This is the world situation. The situation is alarming, particularly India is the number 2 with the number of cases. But if you look at the case surge and the case per million, it's quite comforting position. We are number 2 in the total number of cases, whereas around 110, 120, between 110 20 when it comes to case per million population. But the whole purpose of this slide is to show that you see the proportion of the rise per day, 236.7 cases per million per day in US. That translates into how many? More than 2 lakh cases per day. That means virus is there. Everything, even in the developed country, they are struggling to see. And in the midst of that, they are started thinking about opening of the colleges and the schools. This is another slide which is very interesting. You will appreciate that why we are now having comforting. Before when the epidemic starts, there were no treatment, there were no thing. But as the epidemic progressed, we got matured. Now we are having some information and it is giving some comfort level and the confidence that Yes, this is the age group where less number of cases are happening. You look at this distribution of the COVID cases in India, you will see that in less than 50% in age group of 50 plus, maximum number of very limited number. Maximum cases are happening in the age group, which are more or less outside the home, that is 21 to 50 years. Maximum cases are happening. But the people who are inside or who are in the closer thing, they are less number. Only 15% cases are happening. If you look at the deaths in 50 plus
Sorry,
population,
sir, for interrupting. So we can only see your first slide.
okay, it is not visible.
No, sir. Oh, we can see the first slide.
I don't know why it is not moving.
So put it on the story form.
Please
Move it
come
to the
again.
Story form.
So you.
Hello.
Yes, sir.
What to do?
So you can share again.
Okay.
Yes,
Okay,
sir. Yes, sir. It's visible now.
It's okay? It's
Yes,
moving?
sir. Yes, sir.
Okay. So this is the age distribution which I was saying that maximum number of cases are happening in less than 50% population, 50 plus population, and maximum number of deaths have happened in 50 plus population. If you look at the age group where the children are going to the school, you see that only 15% of the population they are having the infection. Why I am showing this? Because this gives you a comfort that the transmission of the virus is more or less not that rampant among the children and this age group. That's the only purpose. But once the people are they are outside, they are working population, you see that maximum number of cases are happening. And if a senior person is getting affected, then maximum number of fatalities happen. And this is the thing which was used for prioritizing the age group for vaccination. Then during the COVID times, we started with the first case in Kerala on 30th of January. As I was mentioning earlier, we didn't know what to do. And we stick to the basics. The basics was that what we used to do when we don't have an answer to this kind of epidemic. Way back, we used to have lockdown as a measure so that we can get time for preparing for the measures to be taken for containing the epidemic. As a result, what happened after the Janata curfew on 25th, we had lockdown, and still from then the schools were closed, and now slowly in some of the places they are gradually opening. Why? Because now I have shown you the numbers that less transmission happens in this age group, but they need to be protected. They can be potential carriers. The moment they get infected somewhere, they can bring back the infection to the house. And you have seen the fatality in the houses. That means the people more than 50 years of age, it becomes more fatal. As the age grows, the virus becomes more fatal. So now we are gradually opening. While we are gradually opening, these are the following things which we need to consider. Though SOPs are there and the guidelines which have been released by the Ministry of Home Affairs, they clearly say that it has left it to the state governments to devise guidelines. But apart from the guidelines, what else we can do at the school level to see that our children, the children who are coming to the school, they don't get infected. The teachers who are there, who are intermingling with all the people, they don't get infection, and as a result, they don't act as super spreader event for propagating the spread of infection to the other communities. We have to see that how this lot is protected. One of the key consideration in the school is the screening of the children. In our country, what we have seen in the office also, because when this we were the first institution, first government institution to have a protocol. Way back in March 2020, we had a standard operating protocol in place in our institution. It was said that it is our responsibility. It is our responsibility for our health as well as the others' health. That kind of thing. That means the person has to be responsible. If the person is sick, he should not be coming to school. Neither he should be masking his symptoms. Neither he should be taking any medicine and say that I am okay, I am taking an antihistaminic, I am taking a paracetamol and coming to the school saying that I am all right. we have to see that when we are doing a health screening, we should ask that, have you taken any medicines? It's not just taking a temperature. And the temperature guns which are using is just a ritualistic exercise, and most of the time it is coming 92, 93. It never comes 97.
I'm
But
so
if you-
sorry, sir, for disturbing you again, but we cannot see your slide. If you can just press F5, F5, and then move the slides.
Okay, it's now visible? No.
So,
Can I share the slides again? Now it's
yes,
visible?
so you can share again.
Hello?
Yes, sir.
Sir, the display has
Hello,
stopped. You have
Anissa.
to share
Is
it
it visible?
again. No. Sir,
I
you have
can't hear
to.
now.
Sir,
Can you hear me, sir? Hello? Am I audible to you, sir?
Okay, is it visible now?
So you have to do a slideshow. There
Can't
is a
hear.
so you have to do slideshow. The option you see on the top.
Shivani, please type into a chat
Sure.
to sir so he can read it out.
I'm not able to hear anything.
So you can continue. So you can continue your drizzle.
Hello, I'm not able to hear anything.
So you can continue. Hello, sir. Oh, so Aliza, there's a network issue from, you are on mute, Aliza.
I am just conveyed a message to sir. I hope just if he reads and he can continue. He left the meeting. Okay. I would like to welcome our next panelist, Major General Ashok Kumar Singh, served in Indian Army from 1976 to 2012, all over the India, especially in the regions of Bhutan, Assam, Srinagar, Pune, and many other places. Been to Canada, Austria for conferences and official duties. His areas of interest are in rural health through telemedicine. Presently advisor in health informatics to Mahatma Gandhi University of Medical Sciences and Technology, Sitapura, Jaipur. Over to you, sir. We welcome you.
Thank you. Can you hear me now?
Yes, you are audible, sir.
Okay. Now, the topic that has been given to me is talk about increasing the effect of telemedicine in schools. That is one. But before that, I would like to talk about a few things on prevention of what could be preventive health in a school today. Now, please understand, whoever you are, your principals, teachers, everyone, that this has been a very tough time since March 20, and the children have been isolated. Now, once they are isolated, they have not been able to move out. They have not had peer reviews. They have not had peer talks. So it's been a very tough time for the children. Though it is well known that the children are very resilient, they can come out of any situation. But as principals, vice principals, as teachers, one has to take care of what to do with the children. Once the school opens up, they'll be more excited. They'll be wanting to run away, run around. But somewhere along the line, they have to be put into a lot of performing arts to take out the emotions that have been curbed by because of this lockdown. Especially when you have nowadays the norm is single child or two children. Now, once you have a single child or two children is okay, they can fight it out, they can do it. But if you have a single child, it's quite a bad situation. The father is working, the mother is working, the child doesn't know what to do. She or he is sitting in one corner trying to look at the school curriculum, all that kind of thing. So that is very important for you to understand. At this time, at this juncture, I don't think marks and all these things have an effect. If you do a survey or you do some sort of literature search on the Spanish flu, the post-Spanish flu traumas were very high. Similarly, in this also case, you would have some side of brain health problems would occur because of the suppressed emotions, suppressed moving around, doing all that. So that has to be taken, and that can be done only in a very preventive manner and in a very positive manner. So one of the few things that I'd like to say is let them express their whatever frustration is on paper and colors and all that. Let them do drawing. Let them do dance. Let them play around in a game. But follow the norms that have been done. That is washing your hands, keeping a mask on, and keeping social distancing. That is going to be very important in the first few months now. Though it is declining, COVID is declining, but there is a reimburse. It's coming up in Maharashtra, it's come up in Kerala. One school had 7 children in Kerala who were COVID positive. So it's a very important thing that you have to do. So as school teachers or there will be a tremendous amount of faith that is required from the parents also. Parents are going to be very, very critical about anything that goes wrong because they are sending their children to you with all the faith. So now the second topic that is there is that how do you sort of reinforce the health system that you have? Every school has a nurse or a person who's trained in a paramedic or trained a little bit in how to look after children. In March on 20, the government of India released telemedicine practice guidelines. It was followed by Gazette notification, and from what was a telemedicine room in a school, it is now open to mobile application. So it is important that whoever is practicing telemedicine in the school or anywhere else, please ensure that you know what telemedicine practice guidelines are. The Telemedicine Society of India, though presently I'm not the president of the society, I'm now the immediate past president. Colonel Ashwani Goyal is the president of the Telemedicine Society of India. And we have a training program. We have trained a lot of doctors and a lot of paramedics, including certain army doctors also in telemedicine practice guidelines. A few things that are required there are, number one, the first call has to be a video conferencing. Without video conferencing, you cannot see it, though it is said that the first contact should always be a physical contact, which may not be possible in a school. So my advice to you is anyone who's with your schools, you want them trained, the TSI is willing to train you. We will do it, and just let us know the number. We already have a course curriculum which has been talked to the doctors. In case it is nurses or some other paramedics, we'll sort of bring it down a little to that level. So that is one thing that is there. Now, eSanjeevani is a mobile app which has come. Now, eSanjeevani, which is there, is a mobile map given by the Government of India, Ministry of Health and Welfare. And it is basically it has got two this thing. One is doctor to specialist, the other is patient to doctor. So you open up the app, you give your location, and you sort of ask for an appointment, you get a token, and the doctor who's nearest to you within your state or within your city, he will give you the what you call consultation. The schools have got some doctors who are empaneled on their school also, so they could be the best answer. That is what is important to this thing. So anything on telemedicine which is required to be done, please contact us. Please contact Colonel Ashwani Goyal. I'll share the link with you. We'll be able to do it. In case you are in Rajasthan, I am the president of Telemedicine Society of Rajasthan chapter. We'll be able to help you out. That would be no problem for us. Since I work in Mahatma Gandhi College, Medical College and the hospital, we'll be able to help you out. Okay. Now, the one important thing which is there, you are giving tools to the doctor, to the teachers, principals. One tool is telemedicine. It's an internet-based thing. The second tool would be think about brain health. Because when you talk about mental health, it's got a lot of connotations. It's got a lot of things that you can think of. But brain health is a very positive kind of a thing which you can give, because we have a lot of people who have gone through. I know an NGO, rather an establishment which gave in Dehradun, there were 30 girls who took this brain health and they were very happy. They were filled with happiness and their performance improved. So that is one thing. And I think we are doing fairly well. India has done a wonderful job by curtailing telemedicine or the COVID. But there is an issue that we are becoming very, very complacent. I don't think we should give up in the sense that lose don't let your guards off. Let the mask be a very important thing. Hand washing, sanitization is a very important thing. So that is my take on this. And I thank you all for giving me this opportunity. Any question and answer later on, I'm here. I'll attend this. Thank you.
Thank you so much, sir. Thank you for such great insight about the importance of following norms and about awareing us about the telemedicines. Thank you so much. Also, Dr. Madan.
Okay,
you can
thank
continue
you.
Now. You can continue.
Yes, I think we have spoken about the rising trends in the epidemic, and we were talking about the COVID timelines. And during the COVID timelines, I will take what Major General Ashok has told, that the telemedicine guideline. At that time, we felt that the people are stuck in the homes. And the regular checkup were not happening because medical professionals are also not sure how to handle this pandemic. Initially, it was told that it will spread by surface to surface contact and that kind of thing. That was, even the medical professionals were not aware. And most of the people, they were stuck in the homes. And telehealth, teleconsultation, telemedicine, by doing consultation on telephone, you are having orders, and the courts have taken cognizance saying that they are not legal. To provide a legal understanding to that, the Board of Governors and NITI Aayog, they come up with these guidelines for the epidemic, and it is helping a lot. It has evolved, the e-Sanjeevani, other things have evolved around that. So to facilitate that thing, I will not be focusing on, I will just focus on that. After that, the schools have closed. Now they are gradually opening. I will just pose to the question. Virtual media, everybody is doing it. Virtual teaching is happening. So what is missing? Why is the need for opening the teacher? One of the questions have been posed. If you look at the small children, they can learn everything, but not the cognitive skills, which are very, very important for the growth and development of a student and a person. And that is only possible in classroom teaching, one-to-one interaction with the teachers, and the teachers are having a wider role in playing that. That's why 1 year is a very long time, and you can see the frustration, the pent-up emotions of the students once they come, as Major General Ashok has already told about that. Once they come, some catharsis has to happen, either in the form of drawing, either in the form of outdoor sports. That kind of catharsis has to happen. Unless cognitive skills are there, you are moving towards a society, or you are training the future citizens of the society. What will be the mental status of these people? We can't be in lockdown, we can't be escaping everything without going back to near normal or normal. That's one thing. Now we are gradually opening. Ritik, please, next slide, please. So when we are opening the schools, I was speaking about the health screening. It's not mere temperature checking, but we have to see and make the person responsible. If he's not well, we have to take the person on face value. Whatever he's saying, if he's saying I was not well, we have to agree to that. We should not penalize that person saying that he's not well, he's making some bahana and other things. We should not be doing. We should make him so responsible that he will be responsible for his health as well as the other persons. The bottom line is that be responsible, prevent the spread. Health screening, hand washing, the COVID appropriate behavior are to be there. You ensure that they use proper mask, and they should not be touching mask. As you have seen that every other time they will be touching the mask, adjusting the mask. Ask them to wear an appropriate mask so that obviously they will not be touching if they wear a very good fitting size mask. That's one thing. And they should be washing their hands. You might have seen that during the course of this epidemic, how many of us has this seasonal episode of viral infections? Because we are having appropriate behavior, we are having awareness about our behavior. The respiratory ailments we used to have twice or thrice in a year, it has come down. If you look at the diarrhea and other episodes, I'm just talking, just see for yourself. We are so aware about hand washing and the hygiene that the diarrheal episodes have also come down. But the way which we are lacking is the cognitive skills, the behavioral skills, the societal skills, that is missing. That can only be imparted one-to-one. Physical meetings happen between the teachers and the student. That's a wider role which the teachers has to play. Apart from that, every school is having a quarantine policy. If it's a boarding school, if other schools, they usually have their own policy that if somebody is coming, some of the schools, they will insist that the person should be COVID negative or he is vaccinated. Children vaccination is not happening, but in the Western country, they're insisting for certificates. Another aspect to reduce, because it is now established, we have to understand the science behind why this kind of appropriate behavior is there. First, you have to make the students aware that COVID is spread due to touch of these secretions. Second is the aerosol transmission. And aerosol transmission usually happens when the person is very near. That means within 3 to 6 feet, if the person comes in contact without wearing mask, the person is exposed to the virus. Okay, that's why this appropriate behavior is there, so that the aerosols which are generated by talking, by shouting, by coming closer, they are not being transmitted to the other person. If one person is wearing mask, the other person will. This kind of education we have to give to the students when they are coming this, so that once they feel that it is their responsibility not to transmit, they will behave like that. The other thing is the classroom space, and is quite practical. Since last lockdown till now, I have not taken a single leave. I've been going to the office and in the midst of this COVID pandemic. That's not an issue. If you are taking appropriate appropriate precautions, you can always do that. Next is the arrival procedure. The school should be having this. What if they are having SOPs around all these things? Then it's very easy to manage things. It's not that because if you look at the way the things have progressed, we have just stick to the old basics, the basics which we were having during the early 90s. We are just sticking to the same methods for containing the epidemic. That is test, treat and test and trace, as well as containing the spread of the infection. We can always do that. Apart from that, one of the possible areas for transmission in the schools is during the lunchtime and the loos, the washrooms. They are the potential source of infection. See that the hygiene, sanitation of these areas are being regularly monitored and adequately taken care of. So that means the meal rooms or the lunchtime, as well as the washroom, they are the potential source of infection. If you are able to sanitize them and you see the hygiene and other sanitary aspects of that, then that kind of protocols that the schools have to develop. Then, as I have mentioned earlier, that there are pent-up emotional demands. Unless some recreation happens with the proper social distancing and other things, you are not contributing to that. So they would be very happy. Then during the transport also, we have to see that how the appropriate behaviors are taken care. In metros, they have started. Everybody was worried that after the metro, they would be rising the spike in the cases, but that has not happened because they are ensuring the screening of the person, they are ensuring the tracking of that person, they are ensuring that the person behaves appropriately when he is commuting in the metros. Okay, next please. Next slide, please. Now, one important aspect, the question which was asked by one of the participant is that why it is necessary, that I have already answered, that the cognitive skills and the other mental issue that can only be solved when the person comes to the schools. Though there would be chance that the person can get infection others, but we have to weigh the risk versus the benefits of that. Apart from that, in the schools, we do have nurses or we do have empaneled doctors. But going in front of the doctors and talking to them is very difficult. Some of the questions that have been asked that what is the answer if the person is having a mental issue. In India also, a lot of stigma is attached to the mental health. So if a telehealth or a teleconsultation happen, telemedicine is the only restricted entity, but the telehealth is a wider thing which uncovers everything. So we have to see that a telehealth center in the US, they are having telehealth centers. In the school telehealth centers, they have done wonders because it offers an opportunity for healthcare access to all. The person need not to come to the counselor for the sake of, because the moment he comes to the counselor, everybody knows that he is having some issues. He won't be coming forward and he want to hide his sickness, that because stigma is attached to that. It offers an opportunity for health access and equity. And research has shown that students with access of care to health, telehealth, shows improved in health and outcomes in education, because abstinence is reduced. The telehealth has reduced the mental problems there in the studies which have been there, as well as you have seen the episodes of asthma is also reduced in some of the studies which are there. And the access to the health, because if somebody is there to counsel that you come to the school, you can get treatment, only online thing is there, and a lot of things have been facilitated. Had it been some other times, we would have met in person about this workshop. Now it's very fast. Now we are doing virtual meeting, but this telehealth is also a kind of concept, and the schools can widely see that how they can better utilize this. Next slide, please. This is not the next slide. Okay, that is there from my side. I think the question.
Just a second, sir. I'm just sharing again. I think.
No issue. That was the last slide. I have checked it. So this is all. That means the responsibility, our responsibility, to see that the cognitive skills, the mental issues which the students, because in the home there's a constant nagging from the parents and the peers, they are there. But if they come to the school, then you see that how we can better see that they don't get the infection and how we protect ourselves and to prevent the spread of this infection to the other. That's our responsibility. Okay, please, over to you.
Thank you so much, sir. That was really insightful about how you shared all the key consideration that we all have to keep in mind while sending our student to school, and even all the cognitive development, skill development that a student require. Thank you so much, sir. Now I invite our next panelist of the day, Dr. Poonam Joshi. Dr. Poonam Joshi is an associate professor in nursing, College of Nursing, AIIMS, New Delhi, and holds a PhD degree in nursing and has 70 publications to her credit. She is a master trainer of essential newborn care, integrated management of neonatal and childhood illness. She is also a national master trainer for community health officer training and many more. Dr. Poonam has written books and monogram on textbook of pediatric nursing, textbook of nursing education, monogram of diabetic mellitus and its management. She has won many awards, including first prize in Exhibition of Student Nurse Association, award in Pediatric Health Nursing, award for Best Infection Control Nurse Award, Emergency Medicine Fellowship, and a lot more felicitation under her name. We are so glad to have you, ma'am. Over to you.
Ma'am, you're on mute.
Hello, ma'am. You can start.
Yeah. Thank you so much for the kind words. And first of all, I would like to thank the Sharp NGO for giving me this opportunity to be here in this forum and discuss the role of nurse, how important a nurse is in the school health services. So this is what I'm going to deliberate on. Professor Madan has already touched upon some of the things which I was planning to cover in my presentation. So it is going to be some repetitions you will find in my presentation. So I start. I hope I am audible and my slides are also
Yes,
visible to
ma'am. You are
everyone.
audible.
Okay.
Yes, ma'am.
So you can see here, school health program is a very old program which is running in India for the past 70 years. And the nurse is an important member of the school health team, which is comprised of principal, teachers, and we do have parents and children. And because ultimately it is a nurse who is aiming towards taking care of the environment of the school, and everybody has a say, has a contribution in maintaining the environment. We all know that COVID-19 has totally changed the situation, and the role of a nurse has become very complex these days. And with the decision of the government of India to open the school, now nurse has to be when they are coming to the schools, they remain safe, and as well as the teachers who are equally at risk of contracting this infection. Dr. Madan has already told us that this infection is less likely to be seen in children, but however, they are the carriers and they can spread infection to others very fast. And maybe if one person initially infected, he can become a hotspot in just a day or two time. So one has to be very, very careful. Before I further explain about the role of nurse during COVID-19 pandemic, I would like to just say what were her responsibilities prior to COVID-19. She's responsible for, you can say, maintaining a safe environment for preventing the illnesses, controlling infections, and various type of disease conditions you can see in children, like the children, they can have malnutrition, they can come to us with infectious diseases, intestinal infections, the disease of eye, ear, and the dental caries. Many times they do report with some kind of behavioral problems or habit disorders. So ensuring that the first aid was provided to these children at the time of emergency, and she was there to look after children for their minor ailments. In addition, she is responsible for immunizing children and maintaining records, health records in the school, and communicating with the children, educating them, and also assisting if there is a midday meal program going on. So these were the responsibilities prior to COVID-19. these responsibilities will continue, but in addition, you will find that a new infection has been added to the list, the COVID infection, which is highly infectious. So this is something to be taught to every child. I know it is very easy to teach the senior students, but the young ones may not be that much sensitized, or they may not adhere to the policies and the protocols which have been formulated to keep each one in the schools safe. So here the responsibility of nurse as well as the teachers and the principals get increased many times. Next slide, please. Now, during COVID-19, we have also seen that the children have been away from school. They are off track, and they are feeling isolated because of lack of socialization. And there are many activities have got reduced, which they used to perform earlier. And to some extent, you can see it has affected their nutrition, as there is no more nutrition program going on. The immunization, which was earlier a regular activity in the school, is now missing, which has to get restarted. And similarly, there are now children who are the students who are more in need of mental health services. Next slide. So this is the multi-level coordination. We know that everyone is working. It is the government of India giving guidelines and disseminating information to the institutions, to the authorities. Then we have the people working at sub-national level and then at the school level. So today, what we are going to focus is on what is our responsibility and how we can make the environment safe for our children. Next slide. So our students, they are to be welcomed back, but at the same time, there is a word of caution. We have to make sure that they are maintaining social distancing, they are ensuring hand hygiene, and they should exactly know how the hand washing is performed. So as a nurse, a school health nurse can disseminate this knowledge, and even they can make the students practice hand washing in a proper manner. So this is one thing which is required to be taught to each and every child who is coming and attending this school. In addition, you will find the other challenges which we have. They are related to the crowd. Like right now, we have only senior students who have started coming to the school, but now very soon, all students. So it is going to lead to the problem of overcrowding. And now coming to the school itself, it's a difficult thing for the children, as they are coming in school buses. So we have to make sure that the school buses are not crowded. Maybe more number of trips are to be arranged for the students, or we can have some staggered sessions. And then the screening, as Madan sir said, that screening is to be done at the entry level. So anybody who is reporting with fever or is having bouts of sneezing or cough needs to be properly investigated, and if required, they need to be quarantined. But at the same time, we have to ensure that the online education is going on for them, and if they are stable, they should be made part of the teaching and learning activity, and they should be motivated to attend more and more blended learning. So after transport, the other things is here you can see referring to the hand washing facilities. We have to teach them how to wash their hands properly. Next slide, please. Next slide. So the norms which are recommended for prevention and control of infection, they are to be repeatedly reinforced, and we need to sensitize our students regarding these so that they comply with the given instructions. Maintaining social distancing is very much essential. This is the the key component that we have to all the existing hand washing facilities. We may find right now, the currently, we may have less facilities available. We may have some resource constraints in terms of infrastructure, in terms of facilities. So these facilities are required to be increased, and the periodic examination are to be carried out. Any child who is found to be not doing well or is not looking well needs to be examined, and the parents, they are to be contacted, and some arrangement is to be made so that this child is encouraged for maintaining isolation till the time of his complete recovery. We do have, along with normal children, you will also find that there are children with the special needs, like we have children who have diabetes or who are having some other disease like kidney disease. Nephrotic syndrome is very common in some children. They are vulnerable, considered to be vulnerable, and the other conditions, health conditions, if they have like asthma, we said. So these things should also be taken into consideration. These group of children who are having some kind of comorbid illness, they require special attention, so that the overcrowding, which is currently, which was earlier present, does not affect their health, adversely affect their health. Next slide. So safety measures, as it has been repeatedly emphasized, that hand hygiene, maintaining respiratory etiquettes, teaching them how to sneeze, making use of handkerchiefs, or if the handkerchief is not available, or if they have lost it, at least they can make use of their sleeve for covering their mouth and nose. And wearing mask is very much essential in a proper manner. As sir again said, they are to be taught the exact way of the proper appropriate way of using mask is required to be taught to our children, and they should not be playing with these masks. That is to be made sure. Next slide. So we know, as it has been said, that giving health education is an integral part of the school health services. So everyone, it's not only the nurse, it's everyone who is coming in contact with the children, like all the teachers and the principal and all significant ones present in the school. They have to continuously educate these children and make sure that they are complying with the recommended norms, properly wearing mask, observing coughing etiquettes, washing their hands periodically, and avoiding any kind of human contact. Hello. Yes, next slide. Maintenance of record is another responsibility of a school health nurse. So all those children who are becoming symptomatic or getting infected, their record is to be maintained. And very soon in the future, when right now the children, they are not considered to be appropriate for vaccination. But in future, if we have vaccines available, then her responsibility in vaccinating children will also be included. Next slide. So hygiene and the cleaning protocols, periodic cleaning of the washrooms, of the classrooms, maintaining appropriate distancing, spacing the desks. These are the things required. So for cleaning protocols, is something which should be ensured, and if required, we can use some chemical agents like hypochlorite solution, which is recommended for periodic cleaning of the surfaces where the virus is likely to survive. So again, we have to give emphasis to proper and regular cleaning protocols are to be included in the school. Next slide. So again, this is just the reinforcement of what I said earlier. The school health nurse is responsible for maintaining the nutrition, identifying any abnormality in the behavior of the child. In case if of any emergency, first aid services are provided, examination of the oral cavity for any dental caries, eye examination, ear examination, and giving health education. So these are the key responsibilities of a nurse. Next slide. So again, the same thing, teaching repeatedly our children about preventing the spread of COVID-19 infection. Next slide. So as a conclusion, the school nurses, they are the main point of contact for any and all the things which are related to COVID-19. We have to realize that right now we have some constraints in the school and there is no perfect solution available to us. So we have to devise our own ways and means to make the school environment safe. No one solution is considered to be appropriate for all types of schools. So depending upon the available resources, we have to decide the ways and means of curtailing this infection. So nurses, they are along with the principals and the teachers, parents, and the students, they can play a very important role in making the schools safe. Thank you.
Thank you so much, ma'am. You have very well discussed about strategies, interventions, challenges, and what protocols can be followed and how it can be implemented amid COVID-19. Thank you for your valuable views, ma'am, over the topic. I would like to welcome our next panelist, Miss Anu Bhatia. Miss Anu Bhatia is a principal from St. Edmund School, Jaipur, having a rich experience of 22 years of teaching business studies and administrative experience in the field of education. Worked as CBSC Master Trainer, Content Developer, Manual Creator on Adolescents, Gender Recipient of Green School Award from CSC, Clean School from Nagar Nigam, International School Award from British Council. We welcome you, ma'am. Over to you.
Thank you. Thank you, everyone. I would like to thank the NGO Sharp for providing me opportunity on sharing my views on this very much needed and relevant topic. And I also thank the rest of the panelists as they have shared valuable information, because we are working in schools and dealing with the most, we should say, school and school students and teachers are the most, sufferers of this COVID, because this is the only sector left after the lockdown has shut. Still, schools are not fully opened. Since there was lockdown since March, it has created a lot of interruption in the social, in the emotional development of children, and not only children, also of parents, because parents, they were having a pressure of paying the fees. Most of the parents, they were feeling of have job insecurities and so many things, so many reasons which directly or indirectly affected the feeling or that survival of a child during that time. So thank to God that now we are moving forward toward a positive way. And I'm not meaning, I'm not saying to mean about this positive word which proved negative in that COVID time. Now this transition of changing the meaning of positive, where everyone was scared of hearing positive word. Now this transition where the schools, they were not allowing the children to bring mobile, and it was compulsory for them to have a mobile phone to continue your education. So talking about all these issues, thinking about all these things, now coming to this, the major issue, that safety of children after the reopening of the school, because some schools have opened like up to some extent, like in Rajasthan government has allowed the school from 18th of January, and then later on from 8th February they have allowed for middle section students. Now as school leaders, or as teachers, what we are working for the safety, so we have begun the process by first taking the consent of the parents. We sent a link to the parents that first of all they need to assure whether they are feeling okay in sending their child. Otherwise we are also providing the education online, but seeing the emotional development, and the students, they have not met their friends, they are missing everything, and they are missing their extra activities. Still now these activities are not allowed, but still we try to manage it at our own, and we have issued some precautions. So if like ma'am was telling, Madam Poonam was telling about the nurse role. So our school nurse has a crucial role to play in tackling coronavirus. She communicates key communication or key information from health authorities to the school community, and she provides, factual information to reduce, which help in reducing the stigma, to assess the students and staff for illness. And then, like washing your hands after 20 seconds, I suggested my teachers as well. So instead of saying good morning or replying them to that, tell the students to bring out your sanitizers and sanitize your hands in after, if every 1 hour. Then the school nurse also visits every classroom and does random checking of students and staff for any possible symptoms. And no one, even with this minute possible symptom, is not allowed to enter into the school campus. Then coming to the, if any child or any staff has contacted any, contacted any person who was the sufferer of this, the school has also tied up with nearby hospitals to have, to deal with these kind of emergencies. Now, at the entry of the gate, we have, the school is equipped with adequate supply of so many things, like if we talk about thermal guns or pulse oximeters and face shields to provide a safe environment. Then poster and standees at every distance at regular intervals of, in every area, and 1% sodium hypochlorite solution to clean up all these surface areas like furniture, switches, door knobs, toilet gates, entry gates, handles, everything. And the entire school building is sanitized for twice. Then coming to the, if we are talking about parents, so when the students, they are coming to school, we need to provide a checklist to parents and students as well. So checklist may have these kind of points like regular monitoring of child's health. We can advise parents also to have a look on child's health, and if there is any fluctuation, they can have inform the school authorities timely. And then keeping of child at home if any specific medical condition the child is requiring, because it is not right now, it is not safe. And we are providing equivalent facilities if the child is sitting at home also. But if he is coming to school, we need to have this precaution, and then teach and model good hygiene practice at home as well, like washing the hands, wearing the mask, keeping social distancing. Same we are doing with the seating arrangements in the school as well. Then very important thing, that is to ensure the emotional safety of a child through different means. You can organize a virtual parties, virtual meets with their friends, with their teachers, and a virtual fair or visit, whatever we have organized many competitions virtually. But now if they are coming to school, right now it is not possible because it is now the exam month and many parents are looking after, the whole year has went. So they are looking after the education point of, from education point of view. So what we are doing, we are telling them not to focus on syllabus, but to focus on the emotional development and how to integrate it with academic content. So we are providing peer learning as well. Peer learning, but not by allowing them to sit together. And so many other things like students can share, and classroom discussions can go on where a child can explain the things, the other children can interestingly listen it. So these kind of things. And then we have arranged one checklist for student itself. Like if they are feeling any stress, they need to inform us, and school counselor is there all time. And personal service she is providing to deal with every, emotional question or any problem or disorder is coming from parents or students' side. Then children need to protect themselves by not sharing their food item, washing their hands frequently. And then as leaders, you can tell them that whatever you are sharing, You need to share everything you learn about the prevention of disease, and then to follow good practices such as sneezing or coughing by using your elbow, not to stigmatize your peer if they have suffered from this COVID or anything. And the above last, that is, you need to tell everything to your parents and teachers and students. They have a good bonding with them. All time they are available online. They can have their personal WhatsApp groups. So these kind of foundations are right now not there. So this transition will definitely help us in providing safe and healthy environment. So these are some precautions and these are some suggestions for all the leaders, because we have to look forward toward a positive way coming or waiting for all of us. So this is all from my side as I'm dealing with a school in the capacity of a principal. So if you have any question, definitely you can ask. Over to you, ma'am.
Thank you so much, ma'am. You explained everything so practically, that how parents and how students, what they need in times of COVID after coming out from such a long gap and going to school. Thank you so much for sharing your views. School health screening program conducted by Sharp NGO is one of the important components and key areas of delivering health. As a health NGO, it is our foremost duty that health and services can be reached in all nooks and corners of the country. Before starting the Q&A round, I would like to introduce a short video encapsulating the journey of the health programs conducted and successfully implemented in different areas of the country. We mobilized communities, youth centers, in and out of school children and teachers to spread awareness. While we go through the video, I request all the attendees to please post their questions in the Q&A box. Here is a video encapsulating our journey. I request all the attendees to please post the questions, and the sharpest question will be given a gift voucher of rupees 1000 from Sharp. Please play the video.
मेरा नाम आयुष है। मैं चौथी कक्षा में पढ़ता हूँ। मेरे स्कूल का नाम गवर्नमेंट प्राइमरी स्कूल नारकुटपा गुरुग्राम है। हमारे स्कूल में सरपंचियों और ओलंपियाड्स ने हेल्थ कैंप लगवाया है। गुड टच और बैड टच के बारे में सिखाया था, न्यूट्रिशन के बारे में और स्वच्छता के बारे में सिखाया था। उसमें
दांत दर्द दे रहा था तो समझ में आया था ना कि ब्रश करना कितना जरूरी है।
हमें बहुत मजा आया।
टीथ होते हमारे चार, कौन कौन से?
तरीके के पोषक तत्व होते हैं जो अभी खाने में आपको मिलते हैं। पहला वो बोलते हैं कार्बोहाइड्रेट्स। आपने सुना है कार्बोहाइड्रेट्स? दूसरा जो घटक है उसको कहते हैं प्रोटीन।
दांतों में दर्द करता था और आंखों में से पानी भी आता था, पर शार्प, एंजियो और ओलंपिक्स ने मेरे मुश्किल को हल कर दिया। और मैं बहुत खुश हूँ।
Thank you so much, Ritik. Now, the one of the most awaited moment of our webinar, the Q&A round. So, the first question from the panelist is, how will the COVID vaccine arrive in school and help students? All the audience would like to know that. So,
Yes, I have already answered this, but still for the sake of the other participants, because if you look at the situation under which the vaccines were developed, it's an emergency situation. It's not that previously the vaccine development used to take years because the technology was, now we have perfected the platform on which the vaccines can evolve. Having perfected the technology of evolving and developing vaccine, we have to test it. The vaccine undergoes 3-4 phases of clinical trials. We call them clinical trials, which usually talks about the efficacy, whether it is safe, what is the safety aspect, whether it is safe for the human beings. First, the animal trials are there, then we will see the safety dose, in what dose it is administered. Then you do the second phase, that whether it is generating some immune response or not, the immunogenicity they call. Then comes the efficacy. That means you take a trial. In that trial, 50%, if you take a trial in 100 people, 50 are administered a placebo and 50 are administered a vaccine. And given the exposure and other thing, we will try to find out how many people get infected. That is the effectiveness. So till phase 2, everything is okay. The phase 3, because it's an emergency situation, the World Health Organization says that if the vaccine is effective 50%, then it is fit for controlling the pandemic. Getting vaccination does not say that you are free from virus. Virus can come and attack you, but you won't be affected by the virus, and your body system is so strong so that the effects of the virus are minimized and the catastrophe due to the virus is not there. Okay, but if you get infected, you will be transmitting the virus. So appropriate ways to be there. Another aspect is the question which you are told that whether it can be tried in the schools. If you look, you have looked at the data which I have presented, that only 15% of the occurrence in India has happened in this age group. Apart from that, mortality also is not there. That means they are potential transmitters and they can be protected. And major trials which have happened across the globe, they have not factored. They have been done on population above 18 years of age. Now, after perfecting that, now they are recruiting volunteers and they have started the trials on volunteers below 18 years of age. Till such time the information is available, the results are available, we have to wait till such time that results are out and the regulators, they approve the use of vaccination for below 18 years population. I think I have answered this.
Thank you so much. Yes. Thank you so much, sir. So our next question is from Dr. Mani Prakash.
Yeah. Hello.
Hello, sir.
Yeah. Am I audible?
Yes, sir, we can hear you. So, where are you from?
I'm from Hyderabad, ma'am.
Okay, hello,
And
sir.
yeah, my question is like, I just mentioned, regular medical camps will be organized anyway in the schools. And apart from it, to identify potential people who can be gets these pandemics, what more can be done at school level? This is my question.
There's a very simple answer because in the beginning I told that we have to be responsible.
Yes, sir.
If you look at the office pair also, even the teachers, even the other people who are there, if I'm sick, if I'm having fever, if I'm having body pain, I will take some tablets and I will go to the school. I will mask that I am not well. We have to inculcate the habit that to be honest to yourself as well as the responsible towards others. We have to set in protocols. If somebody is saying that I am not well, if there are sufficient ground, we should not be questioning that you are just making a bahana and you are not coming to the school. For it includes the teachers as well as the students. It should start from there. Having said this, another thing is we should be having protocols. Okay, what to do for preventing for any of the pandemics. Okay, for it's very simple. It's a simple hygiene, sanitation, and the appropriate behavior, the ethics, the civility, the civic aspect. That they are very important for containing any spread. Okay, this pandemic has taught us the importance of cleanliness, the importance of hand washing, the importance of having cough ethics, the importance of having the distance, maintaining distance when we are talking, the importance of not shouting because shouting also generates some aerosols. So we have understood that if we are having an appropriate thing and if we are having protocols, we can always withstand the challenges posed by any of the pandemics. Okay, over to you.
Dr. Ashok, so would you like to add something to this? So you are on mute.
Unmute. Okay. Can you hear me now?
Yes, sir.
Well, I think it's been answered very well by Dr. Sahib. What else can I add is that, yes, we have to be very vigilant in this. And actually, when a child says, I'm not well, the parent says, no, you are not okay. You're in the sense that, no, you have to go to school. That thing has to get out of the head of the parent because the parent doesn't know what to do. In case the offices open up, the best place to put a child is in the school. Now, how do you get out of this? In the sense that the child is saying, I'm not well, the parent says you are well, and it becomes a big thing because now one has to look at it. So I think the school should play a very important role in keeping this child in quarantine, let him enjoy his life as it is coming to him. That's it. Thank you.
Thank you so much, sir. And I hope Dr. Mani got his answer. Thank you so much. Our next live question is from Anisha Mitra. Anisha Mitra. Okay, so our next question is from.
I'm so sorry.
Yes.
Actually, I was unable to unmute myself.
No, it's
good
totally
afternoon, everyone. Good evening, rather. So actually, my question was like, of course, we all have started with the school with the senior classes. But how do we go about in this situation with the junior children? Like when do we can expect them to come back to school in a proper way, like a live school? We can have a lively school with them involving in all activities and everything. Like we are having now, of course, with the COVID situations, we all have a very restricted classes going on, proper sanitizations and everything. So like when can we like expect that normalcy to come back?
Okay. So any of the panelists would like to answer this question? Anu ma'am, would you like to answer? Ma'am, you are okay.
So, ma'am, I can understand your eagerness as a parent when my child can join a school but I would suggest that patience will definitely work a lot, because we also have to follow the government SOPs and guidelines. This is all about your safety, your child's safety, and you need to continuously interact with the teachers, with the staff, because we are not the right person to answer this when the schools are going to open for these junior kids. But slowly and gradually, the government is working in this area along with the board or the education department dealing with these kind of things. So they are working on these things, and whatever would be safe for children will definitely come very soon. So let's pray for it, because no one can answer other than government authorities then when it is going to open. But I would like you to be in contact with your teacher. It would be like an opening for you. Fine, so the whole year they have maintained it, they have bonded it. So I think that gap has been bridged up. So just give that emotional support to your child and to you as well. So this is my view for this question. Thank
Thank you
you.
so much, ma'am. Thank you so much.
Thank you. Anisha, would you like to tell us where are you from?
Actually, ma'am, I'm a teacher. I'm from Mount Litra Z School, Maheshtala, and I represent myself from West Bengal.
Thank you so much. Thank you so much. Now, our next live question is from Arunima.
Good evening, everyone.
Hello, ma'am.
Hello. My question is, despite the availability of help resources and personnel, how to encourage students who are hesitant in seeking the remedy to their mental health issues?
Ma'am, I would like you to contact the school counselor. And I think the school is following the inclusion strategy, and all school counselors and psychologist team is available, because this is the duration, this is the time which we have faced together, and this counseling will solve all the issues. So I would suggest you to be in touch with the school counselor and provide every possible situation where your child can interact with his or her friends, you know. So these kind of things will definitely help you. So everything is all related to mind, because now they are, frustrated of all these foundations. So they want to come out, they want some, you know, that thing. So these social and cultural things and that fulfillment can be done with the help of these counselors. So she can suggest you one good way. Go for that.
Thank you so much, ma'am.
Ma'am, would you like to introduce yourself? I mean, where are you from?
I am Arunima Gupta.
That.
I am Arunima Gupta. I am working as a teacher in Bal Bharti Public School, Rohini.
Okay,
Delhi.
thank you. Thank you so much, ma'am, for such lovely question.
Thank you so much.
Thank you so much, ma'am. Now, I would like to ask our panelists, like, how school health professionals and staff should be trained and to take care of any positive case detected in school. Dr. Poonam, would you like to answer this question? Dr. Poonam, ma'am, are you?
Hello. Yes. Hello. Can you just repeat the question?
Ma'am, how school health professionals and staff should be trained to take care of any positive case detected in school?
I would say that they have to be very vigilant about the cases, and it's mainly by training and by keeping oneself updated about the disease condition, and I think that this is how we can keep ourselves more vigilant, and we can ensure that maybe Dr. Madan can answer this question in a better manner.
Thank you. I was just one interesting thing, because the question which you have posed, that means how these people can be trained to identify a positive case, occurrence of the positive case in the school. I'm right now. You have asked this question.
Yes, sir. In case of a student is
I mean,
detected positive in
no,
school?
how they can be traced to identify what detected. The question should be, what should they do if the student is detected positive? Okay, so the answer is very simple. The the other panelists have also answered this question. One thing is that if the person is positive, the standard protocol, standard operating protocols as notified would be in application, because in the school also, if the person comes to the school undetected and during the course of the visit of the school nurse and the other persons, because they know that the person is not well and the person goes for detecting this, immediately the persons who has come in contact with the boy or a girl and all the class in the vicinity who are the primary contacts, they would be under surveillance, because this is the duty of the person. Because you can't say that as Dr. Ashok has already pointed out, that parents will push the child that you go to the school whether you are well or not. If he has come to the school and the college doctor or the college nurse, school nurse, if they have found that a person is not well, they have referred that person and the person undergoes COVID testing and he is found to be positive, they should be tracking the persons who have come in contact with this. If a person is sick, reported sick in the school, immediately they should make a list of the persons who have come in contact with that person and try to follow that key what has happened with the COVID, whether if he turns to be COVID positive, then all the primary contacts, the contacts of the person, they also needs to undergo a quarantine or a isolation, self-isolation at the home. That kind of measures are to be taken. And most of the health professionals, if they go through the SOPs, they will understand all this thing. No special training is required. They have to only follow the guidelines and the SOPs which have been released in case of any positive person, what needs to be done, and how to take measures to prevent the spread to the primary contact, from the primary contact to the secondary contact. Their responsibility lies in preventing the spread from the person who is reported positive to the contacts who or the persons who have come in contact with that person, so that if that kind of vigilance is there, then the spread of the infection to the other persons is checked. Otherwise, if we are lax in that area, if we are not able to trace the persons who have come in contact with that positive person, then you are aiding to the spread of the infection. I think I am clear in that answer. Please.
Yes, sir, you explained very well. Thank you so much.
I would
Yes,
like
ma'am.
to add something here.
Sure,
Ma'am, need not to scare, because half of the work will get done at the entry gate. Because if a child or any visitor is found with any of these minute symptoms, we are not allowing them to enter into. And
Right.
if we find any changes in their health in sitting in the class, we send the children or child or person to the isolation room itself and then contact to the doctor itself or call the parents. So half of the work will get done at the entry gate. So I don't think so any kind of, that level thing will arise if at entry gate, these kind of checkings are done seriously. So thermal checking and everything.
Thank you so much, ma'am. Thank you so much, sir. Now, Aliza, would you like to continue our second round of questions?
Yes, now I will start the second round of questions. The first question is from Ashutosh Verma. Please unmute yourself and introduce yourself and follow the question. Ashutosh Verma. Please unmute yourself and introduce, followed by the question. Ashutosh, am I audible to you? Okay, so the question from Ashutosh Verma was, can schools help in improving the mental health of handicapped students, those suffer in COVID-19?
I think I have already answered this question. I already answered, because it's a very interesting question. School can definitely help. They do have counselors. They can take the help of telemedicine and telehealth. Apart from that, it's a very unlikely situation given the experience of infection, but that too handicapped children getting infected and coming to the school for this mental health, that's very unlikely situation. I've already answered in the chat box about
Thank
this.
you so much, sir. Our next question is from Shashikant Rendhe. Shashikant, please unmute yourself and introduce, followed by the question. Shashikant, am I audible to you? Please unmute yourself.
Yes, audible. Actually मेरा क्वेश्चन ऐसा था कि अगर हम स्कूल मतलब मुंबई में मैं रहता हूँ और मुंबई के जो स्कूल्स है वो एज ए स्लम स्कूल में हम लोग काम करते हैं, तो ऐसे स्कूल्स में ना हैंड वॉशिंग पॉइंट्स नहीं है, और अगर है भी तो वहाँ पे जल्दी भीड़ हो जाती है। तो ऐसे क्राउड्स को हम लोग को हैंडल करने के लिए मैंने क्वेश्चन पूछा था, तो उसके लिए बताया गया कि सैनिटाइजर्स हम इस्तेमाल कर सकते हैं या बच्चे इस्तेमाल कर सकते हैं, लेकिन बच्चे जो है वो अंडर प्रिविलेज्ड है, तो वो इतना महंगा सैनिटाइजर तो नहीं ले सकते। तो ऐसा कुछ है कि हम लोग उन बच्चों को सर्विस दे सकते हैं, या इस सॉल्यूशन इसका कुछ सॉल्यूशन हम लोग निकाल सकते हैं क्या कि हैंड वॉशिंग पॉइंट्स तो है लेकिन वहां पे जल्दी भीड़ हो जाती है बच्चों की।
Who has to answer this? Shall I answer?
Any of the panelists can take
you have to pose questions so that otherwise it will be difficult.
It's okay, sir. You may answer, and if anybody wants
ये
to, they
बहुत
can.
सिंपल है इसका आंसर, बिकॉज आप बोल रहे हैं भीड़ हो जाती है एक जगह, you have to regulate that. It's an operational problem. ये आदि है और सैनिटाइजर की जरूरत नहीं है। बेस्ट जो चीज है, वाटर एंड सोप इज द बेस्ट सैनिटाइजर। I don't use sanitizers. मैं खाली अपना हाथ साबुन से साफ करता हूँ। Being a medical professional, I know the importance of hand washing with soap. तो आप ये देख लीजिए भीड़ बढ़ती है, तो इट्स एन ऑपरेशनल इशू। आप थोड़ा सा युक्ति लगाकर वहां पे देखिएगा कैसे भीड़ कम की जा सके, वो आप कर सकते हैं। यू कैन ऑलवेज इनोवेट एंड ऑलवेज डू दैट। सॉल्यूशन लाइज देयर ओनली, आप वही कर सकते हैं। सैनिटाइजर के बारे में मत सोचिए, सैनिटाइजर से अच्छा है सोप एंड वाटर जो हैंड वॉशिंग है। आप डेनमार्क में देखेंगे जो छोटे छोटे बच्चों को उन्होंने स्कूल चालू किया था, वहां पे उन्होंने लगा रखे थे, धीरे धीरे बच्चे आते थे, हैंड वॉशिंग सोप एंड वाटर से ही करते थे। दे आर नॉट यूजिंग सैनिटाइजर फॉर द स्मॉल चिल्ड्रन, क्योंकि अल्कोहल बेस्ड है। सैनिटाइजर हाथ में लगे एब्सॉर्ब भी होगा अल्कोहल। इट्स नॉट दैट कि ऐसे ही रहेगा। सोप वाटर इज द बेस्ट। उसके अलावा मत सोचिए, फाइंड अ इनोवेटिव वे ऑफ मैनेजिंग द क्राउड।
Right, sir. Thank you so much.
हेलो
Very
हेलो,
well answered.
आई वुड लाइक टू
Yes.
से कि हम रिसेस जो है वो लंच ब्रेक हम वो कर सकते हैं। वी कैन जस्ट गिव देम इन नंबर ऑफ टाइम्स and one particular section can be given a small break followed by another section like that, so usse
Right.
overcrowding की problem खत्म हो जाएगी। and second thing, we can control the traffic, just make it one way traffic, so that there is no overcrowding and there is smooth movement.
Very true, ma'am.
Thank you.
Thank you so much. So here we end the second round of questions from our attendees. It is the time to announce the sharpest question winner. Would you like to announce, Shivani?
Yes, definitely. So the sharpest question of the day goes to Mr. Shashikant
Renade.
Yes, congratulations. And somebody from the communication team will contact you shortly and give you your voucher. Congratulations once again. And thank you so much.
Thank you so much.
And thank you to all the panelists once again and the attendees for attending the webinar. Now we have a small feedback on your screen. Kindly fill that feedback. It's open for the panelists as well. Also, you will get your participation certificate in your mail within 2 days. Kindly check your spam box as well. You might get the certificate there. You can, if you liked our session, our webinar and our work, you can subscribe to www.schoolindia.org.in for further updates regarding the webinar. Also, Sharp is also conducting awareness session for students on digital eye strain, and we request the principal and teachers to register your school as it's a free awareness session for students and teachers. We hope to see you all next Saturday for another fruitful discussion. The topic will be announced soon in all our social media handle. Thank you everyone. Have a great weekend ahead.
Thank you all the panelists and attendees. It was honor having you all here on the platform.
Thank you so much, sir. Thank you everyone.
Thank you.